Welcome everyone to week number 2. We hope you found last week helpful, and we gather all your feedbacks from week 1 and improve week 2 a little so that um, it helps you better. And yeah, so week 2 topics is abdominal pain, and uh, me and Danny will go over the vocabs for about 30 minutes. And then for the last an hour and a half, you will go into breakout rooms with your TAs and do more scenarios practice. Okay. Him, the TA's thumbs up if my screen's loading and guys can hear me. Okay. Yeah. So abdominal organs. So some of these include, and so focus on the location and the name of the organs. So we have the liver here, gallbladder, the pancreas, the large intestine, right blue, kidney, one left and a right one, bladder right here. We have the stomach at the top, the spleen behind the stomach, the small intestine, which is inside the large intestine, and the ureter, and then the urethra at the bottom here. So this is like a good image to kind of remember, because when we practice scenarios and when we meet patients a lot of the time will describe their pain like, oh, on the right, on the left, at the lower or upper stomach or belly area. So knowing this will help you, like, okay, if the patient has pain on the right, then it's probably like maybe the liver or like the intestine, the kidneys, or the bladder. Yeah. And then Danny will go over this common pain description words for you guys.
Yeah, so adding on to what KG was saying, so these are some like the words that patients might use to like describe the type of pain that they're feeling. So acute pain is pain that starts suddenly. Chronic pain is pain that lasts over a period of time. Colicky pain is a pain that comes and goes in waves. Sharp pain is sudden stabbing feeling pain. Dull pain is a constant aching pain. And radiating pain is pain that spreads from one area to another.
Okay, so this should be in your vocabulary list, and yeah, some of the common conditions for stomach and intestines. So appendicitis is infection of the appendix. Gastritis is the irritation of the stomach lining. Stomach ulcer is a sore in the stomach or the intestine. Gastroenteritis is inflammation of the stomach and intestines. Bowel obstruction is something that is blocking the intestines. And diverticulitis is infection of small pockets in the colon, which is also called the large intestine.
Yeah, and next are looking at more of the common causes of abdominal pain. And these are conditions that specifically affect the gallbladder, the liver, and the pancreas. So first is gallstones. These are hard stones in the gallbladder, which can cause right-sided belly pain. Cholecystitis, or infection or inflammation of the gallbladder. Hepatitis, which is the inflammation of the liver, and pancreatitis, which is the inflammation of the pancreas.
Now we have urinary and reproductive organs. Kidney stones is when there are stones, like rocks, causing severe pains on the side, like left and right sides. Urinary tract infection, which is also shortened as UTI, is the infection of the bladder or urinary system. And ectopic pregnancy, this is when a pregnancy growing outside of the uterus, so it causes the patient a lot of pain. And pelvic inflammatory disease, known as PID, is the infection of the female reproductive organs and usually the uterus, fallopian tubes, or ovaries.
Yeah, and next up we have some common laboratory tests that you would order for abdominal pain. So first are CBCs or complete blood count. These check red cells, white cells, and platelets, and you would usually order it for infection, inflammation, bleeding, or anemia. LFTs or liver function tests specifically checks liver enzymes and proteins, and you order it for liver diseases or bile duct problems. Electrolytes, and they check sodium, potassium, metabolic balance, and you order it to check kidney function, dehydration, metabolic problems. And then next up is lipase and amylase, and both of these check are pancreatic enzymes, and you order it to diagnose pancreatitis. Urinalysis, and this checks infection, blood, crystals, and all this is in the urine. And you order it for suspected UTI or urinary tract infections and kidney stones. Pregnancy tests, and these check pregnancy hormones specifically, and you order it to check for ectopic pregnancy. And then lactate, this checks blood acid level, and you order it for poor blood flow to the intestines.
Yes, so on the right side there's some patient-friendly phrase that you could use to like, for example, if a patient asks like, "Oh, what is CBC?" or what does your analysis do? These are some 10 sentences you can say to them, and we will have an activity later where you practice telling the TA, "Okay, can you explain what this is? What and why do the doctors use it?" So make sure to familiarize yourself with this phrase. Okay. These are common imaging tests for abdominal pain. So first we have ultrasound, and it is sound wave imaging with no radiation, like the right here, and it's best used for right upper quadrant pain, gallbladder, pregnancy, and other gynecologic issues. And next, another one is CT scan for like abdomen, the pelvis, and it's a detailed X-ray imaging, often with like contrast. And they're best used for appendicitis, diverticulitis, obstruction, and any kidney stones. So
All
yeah,
right.
any
Yeah, so next up, we're going to look at some common treatments and procedures. All right, so here we have like a table of each procedure or like medication. So just like generally what the table is like what it is, when we would use it, pros, like what are some good things about it, and cons, like some negative things or like side effects. And again, like patient-friendly phrases, like how you can like explain what these are to patients. So first we have antibiotics, and these are medicines that are used to kill bacteria. And just like it sounds, we would use it when we have bacterial infections, and this can include appendicitis, cholecystitis, and diverticulitis. Uh, analgesic medicine or painkiller so these are medications that reduce pain, and you would use it for a patient that's like experiencing mild to severe abdominal pain. Surgery, and it's a medical operation to treat a condition, and you would use it for either severe or emergency abdominal problems. Colonoscopies, this is a camera exam of the large intestines, and you would use it for anemia, chronic pain, inflammatory bowel disease. Endoscopy is similar, camera exam of the esophagus and the stomach, and you would use this for ulcers, bleeding, and gastritis. Appendectomy, this is a surgical or removal of the appendix, and you would do this for appendicitis. And cholecystectomy is similar, surgical removal of the gallbladder, and you would use this for gallstones or gallbladder infection.
Yeah, so we won't have enough time to go over the pros and cons, but these are helpful to for you to read on your own time. And again, there are patient-friendly phrases that you can use to explain when a patient asks you what it is in simple terms. Okay, so this is a really important slide for you to know. Um, so these are pain locations and the causes. So when they say right upper quadrant, the common organs are the gallbladder and the liver. So right here, and common um, conditions associated with that is cholecystitis, cholecystitis, gallstones, and hepatitis. Um, right lower quadrant, so right here, will be organs are appendix, colon, ovary, fallopian tube, and conditions will be appendicitis or ovarian pathology. So around right here. And then next is left upper quadrant. That's the common organs are spleen, stomach, and the pancreas. So left upper quadrant, or the right. Oh yeah. So left right here. And then left lower quadrant, right around here. So our colon, ovary, fallopian tubes. Oh, sorry. Left upper quadrant is spleen, stomach, and pancreas, and then left lower quadrant are colon, ovary, or fallopian tubes. So right here. Yeah, and then common conditions are diverticulitis and ovarian pathology. Epigastric, so upper middle, so right here. So our stomach and the pancreas. And common conditions are stomach ulcer, pancreatitis. Periumbilical, which is usually near your belly button, right here. It'll be the small intestine, and their common conditions are early appendicitis, small bowel obstruction, or ischemia. And then suprapubic, which is the lower middle here, and organs are bladder, uterus, and common conditions are UTI, pelvic inflammatory disease, PID, or ectopic pregnancy. And this is another table to important to have ready for later when we go into breakout rooms where you have an activity with your TA where you will associate a condition we give you with like locations.
All right, so next up we have our red flag symptoms. So on the left, you'll see red flag symptoms. And what it means for a symptom to be like a red flag is that these are symptoms you should often look out for because they often like could hit as something much more serious or could lead to like much more life-threatening problems. And on the right, like it's why are these symptoms serious and what could it possibly lead to? So first up, we have severe or worsening abdominal pain, and this could often hit at organ inflammation, rupture, or blockage. Pain with fever, this could often lead to spreading infection. A hard or tender belly often hints at infection or leakage in the abdomen. Persistent vomiting, this could mean blockage, severe infection, or lead to dehydration. Vomiting blood often means internal bleeding, like bleeding in the stomach or intestines. Black or bloody stools or bloody poop could often mean digestive tract bleeding or GI bleeds. Yellow skins or eyes often hints up to liver or bile duct problems. Severe pain during pregnancy could lead to life-threatening pregnancy complications. Fainting, dizziness, or weakness could often mean internal bleeding or low blood pressure. Fast heartbeat or low blood pressure could mean could lead to shock from bleeding or infection. Severe pain spreading to back or shoulder or radiating from the back to shoulder could mean like pancreas or gallbladder issues or internal bleeding. Unable to pass gas or stool with belly swelling. This could often hit at a bowel obstruction. And then sudden pain in older adults could result in like or mean things serious causes like blood vessel problems. And then severe pain after injuries. This could often mean internal bleeding or organ damage.
Okay, so now we will head into the breakout rooms, and in your breakout rooms, you will have a little icebreaker, which really fun questions for you to introduce yourself. Practice number one, which will have a little vocabulary practice with you, and then practice two, just like last week, is when you will ask the TAs questions. So have the make sure you have the interview guide out to ask to follow those questions, and lastly, practice three, where you will gather all those information you ask the TA, the patient, and you put them into a summary, just like last week. Yeah, so some reminder and tips. I have sent out all of these PDFs, handouts, in your course website. So please make sure you have them open during your interaction so that it'll help you a lot. So your vocab list for abdominal pain, the patient interview guide, the case report template, and then this is a new one where I include empathetic phrases that you can say, like, oh, I'm sorry you're experiencing that, or sorry you're feeling that way. And please try to use these phrases, sentence after the patient tell you something, because you want to empathize or and make sure that you tell them that you're here to listen and help them feel better. And don't just be like, okay, next question, okay, next question. So yeah, try to use these phrases as in your interview. Okay, so now you will get assigned to breakout rooms, and TAs can start screen sharing from here.